special guest in our office, Dr. Eda Işıl. Hi, doctor. Thanks for coming.
Thanks for having me.
We wanted to ask you a couple of things in order to know you better and about your practice. First of all, can you tell a little bit about yourself?
Thank you for the opportunity. I am a plastic surgeon. I live in Istanbul with my private practice. I am a fellow of the EPOBRAS, meaning that I am board certified of the European Board of Plastic Reconstructive and Aesthetic Surgery. I was born in Germany and I studied medicine in Istanbul. After my residency in plastic surgery, I had the chance of working with a team of highly respected aesthetic surgeons as a fellow. And now I work as an aesthetic surgery consultant.
What are your specialties?
I specialize in aesthetic surgery of the nose, of the breast, and of the aging face.
When you mention about aging face, what kind of procedures are involved in this treatment? Can you specify?
Aesthetic surgery of the aging face involves facelifts, mid-facelifts, and especially rejuvenating surgeries around the eye area.
I want to ask a little bit about surgeries itself, the most commonly asked questions by the patients. So if we talk about nose surgery, rhinoplasties, how is the process? Can you tell a little bit about that?
Yeah, sure. So after you wake up from rhinoplasty, you will have a plastic cast on your nose, and in your nose you will have silicone splints with a hole in them so you can breathe. And you stay at the hospital overnight. You won't have so much pain, and we will give you painkillers to manage the pain. And of course, some swelling and bruising will occur, especially on the first 2 to 3 days, and these will not be as bad so that you cannot open your eyes, so you will be functional. You will be able to carry out basic physical activities, daily activities. And after the 3rd day or so, the swellings and bruising will start to subside. And on the 7th day, you will come back for a checkup, and the cast and the silicone splints will be removed, and also the stitches will be removed. New paper tapes will be placed on the nose for another week, but then you can go home and take them out by yourself.
Okay. Obviously, patients are also curious how their nose will look like, and this is another very common question. How can you answer that question?
So, when my patients come for a consultation, on the initial consultation, I examine my patients, of course, and they tell me what they don't like about their noses. So, and after that, on a simulation application, I try to simulate what the surgery will, what kind of effect the surgery will have on the flaws of the nose. Simulation makes it a bit easier for me also to understand the expectation of my patient, because not everybody's natural looking is the same. And because I'm a surgeon, I try to simulate exactly what the surgery can do, and as opposed to when patients do it on their own on a simulation program, they tend to make it look unnatural.
Thank you for the information. Another question I can think of is how long will the results last? Is the surgery permanent?
Yeah, with rhinoplasty the results are permanent.
Okay. Your another specialty of you was breast enlargement, so I would like to also ask a few things about the surgery itself. Can you talk what are the types of implants, what brands do you prefer?
So breast enlargement is done with implants, and I exclusively use silicone implants of the brands Mentor and Allergan, and both of them are FDA approved for breast enlargement.
Okay. Do you think is there any problem with breastfeeding after the surgery?
Yeah, breastfeeding questions are very common. Breastfeeding problems cannot be excluded cannot be excluded after implant surgery, but it's not an expectation that you will have problems. Especially if the implant was put through an inframammary incision or if the implant is of a small to moderate size.
Okay, I see. How about the results? How long does the results last? Is there a necessity to change the implants after some years? Or?
Implants don't have to be changed after a certain amount of time, but of course breast tissue is prone to aging and patients may notice some change in the shape in maybe 8 to 10 years.
And how does the process go? What happens after the surgery?
So after surgery you stay at the hospital overnight. You can feel a bit pain, but this is manageable with painkillers.
Okay.
And according to what you do, you can go back to work as soon as on the 5th day.
Okay. Do you perform Brazilian butt lift, and what would you say about the results?
Yeah, so Brazilian butt lift procedure is one of the most popular procedures lately. For Brazilian butt lift, we do general liposuction all over the body and inject the harvested fat into the butt and hip area.
Okay.
And it's crucial for this procedure to be a good candidate. If you are too skinny, there's not much fat to harvest and to inject. And also if you carry more than, let's say, 8 kilos too much, then after the procedure you will still look kind of overweight. So you have to be a good candidate. And what we do is we create, with liposuction, we create a narrow waist. So the newly shaped hips are accentuated in this way. I also should emphasize that over a period of 3 months, the injected fat is approximately 1/3 of the injected fat gets lost.
We also know recently patients are asking non-surgical procedures, and one of them is also what you apply, a combination of Madonna lift and vampire lift for the facial area. If you can tell how this procedure works and who are the good candidates, can you give a little bit information about it?
Sure. So we combine the vampire facial with the Madonna lift, and we call this a rich Madonna lift. This rich Madonna lift is a non-surgical rejuvenating procedure combining the unique advantages of 3 different therapies. First of all, fractional laser, which resurfaces the skin and boosts collagen in the skin. And second, radiofrequency, which goes deeper into the layers of the skin and causes a shrinkage, which we see as a tightening and toning of the skin. And third, last but not least, vampire facial. You know about that a lot. This urges the skin cells to renew themselves, and which also aids in the healing process of the laser. So yeah, what is the downtime is one of the most common questions. The downtime should be considered as a prolonged weekend, like 2 to 3 days maybe. So if you have the procedure on a Thursday, by Monday you will be able to start. Of course, some redness and puffiness occurs, but you can apply lots of tinted sunscreen so you don't have to stay home, even if you don't go to work. And good candidates for this procedure are actually people with lighter skin shades and fine lines like crow's feet and maybe fine wrinkles around the mouth area.
Okay, thank you very much for all this information.
You're welcome.
It was very valuable, and maybe we will get together again for another session. But thanks for your time. Hope to see you soon.